Hello, and welcome to the Foot Mnemonics video. I'm hoping in these next couple of slides, I will not only be sharing mnemonics with y'all, but also some helpful learning tools and memory aids that can help you when it comes to test day. Just as a reminder, this video contains mnemonics that are not PG, so here's your warning for that. So I first wanted to briefly talk about cutaneous nerve distributions. Just as a reminder, cutaneous nerves innervate patches of skin, whereas dermatomes innervate strips of skin. So that is kind of a key distinction between the two. So if we're looking at cutaneous nerve distributions on our leg, the area more of on the anterior part of the knee is innervated by anterior cutaneous branches of the femoral nerve. The lateral part of the leg is innervated by the lateral sural cutaneous nerve, whereas the medial portion of the leg is innervated by that saphenous nerve that comes off femoral pretty high up. Most of the dorsum of the foot is innervated by the superficial fibular nerve, whereas the sensation on the lateral portion of the foot is innervated by the lateral dorsal cutaneous nerve. The space in between the first and second toe is innervated by the deep fibular nerve, whereas the tippies of the toesies are innervated by that medial plantar nerve. So I know this is a lot of cutaneous distributions. I wanted to focus a little bit more on two of them for the purposes of remembering them in lab, on an exam, or even just as a general mnemonic. So I just want to talk about superficial fibular and deep fibular nerve. So as a reminder, the superficial fibular nerve innervates the lateral compartment of the leg, whereas the deep fibular nerve innervates the muscles in the anterior compartment of the leg. I remember that the deep fibular nerve can also be called the flip-flop nerve because it gives cutaneous sensation to this area in between the big toe and the little toe right next to it. So similar to if you're wearing a flip-flop, that's kind of where that little spoke goes. So that might be a way that might help you to remember that. We can see this nerve coming down in between that tibialis anterior and that extensor hallucis longus. It kind of is deep in between there, and we can see it come out and kind of extend into this area of the foot. I also wanted to briefly touch on osteology of the foot. So here we have three different views of the foot, just to give you an idea as we go through all of these bones. So first we have our calcaneus or heel bone, followed by our talus that helps make up our ankle joint. We have the cuboid, navicular, and then our three cuneiform bones, lateral, intermediate, and medial. So sometimes the intermediate cuneiform might be referred to as the middle cuneiform, so just know those terms are interchangeable. We also have 5 metatarsals, followed by our phalanges. We have our proximal phalanges, our middle phalanges, and then we also have our distal phalanges. So I also just wanted to note that for our big toe, we do not have that middle phalanx. It's just our proximal and our distal. So I wanted to go through a mnemonic to help you remember the tarsals in the foot bone. So I've cleared out the metatarsals, the phalanges, and I have listed on the side here the different bones that we're going to talk about. So my mnemonic starts off with the cuneiforms, and I incorporate medial, intermediate, and lateral into the mnemonic. So really, we're going to start right here with our medial cuneiform and kind of work medial to lateral and then work our way to the posterior side towards that heel bone. So the mnemonic is my insanely large cock never touches condoms. Okay? So one more time, just so that way you can see it once again and follow along with the image on the left. This is the mnemonic, and we are just going from medial to lateral, and then working our way back to navicular, and then going more posteriorly from there. Ha! Surprise! I decided to make an appearance to talk to you all a little bit more about ankle ligaments, specifically ones you can see in the lateral view. So if we look at this picture of the lateral aspect of the ankle, that's where we can see our 3 lateral or collateral ligaments. So we have our posterior talofibular ligament, our calcaneofibular ligament, and our anterior talofibular ligament. The nice part about these ligaments is that they are named according to the bones that they attach to. So that makes it a little bit easier to figure out what the name of that ligament is. In terms of injuries to these ligaments, that's where I wanted my visual to come in. So I am going to pretend that these are my 3 lateral ligaments on my foot. We're going to say this is anterior, this is posterior. So injuries to these ligaments will happen according to which of these ligaments is perpendicular to the ground at the time of the injury. So for example, if you're walking in your yard and you're just minding your own business and you don't realize that there's a hole and you step into that hole, a lot of times you'll step into it heel first. So your toe will be up in the air, and so that will make this ligament perpendicular to the ground with your toes going up and your heels going down. All right, so that puts your posterior talofibular ligament at risk by stepping in a hole. All right, our calcaneofibular ligament is the one that seems to be a little bit more perpendicular to start off with, right? So with our calcaneofibular ligament, if we jump up in the air and then we land flat-footed, or we're jumping from a height and we don't bend our knees, well, we'll get knee issues with that case. But if we just land flat, we have an issue, we can potentially have an issue with our calcaneofibular ligament. So that's any flat-footed type injury. For our anterior talofibular ligament, that ligament is the one that's most commonly injured. And part of the reason is that if you think about, remember, this is our anterior side. If you're jumping up in the air and you're landing, instead of landing flat-footed and potentially injuring this ligament, you tend to land on the ball of your foot. So when you do that, you shift this direction to land on that ball of your foot, and in doing so, you make that anterior talofibular ligament perpendicular with the ground. So that's why this ligament tends to be more commonly injured out of the 3. Okay, I've disappeared again, but don't worry, I have another visual aid to help you understand the medial ankle ligaments. They'll just come in the next slide. So if we're looking at the medial aspect of the ankle, we have our medial or our deltoid ligament. They do have separate names for each of them, but for the most part, your responsibility is only knowing that the deltoid ligament is located medially at the ankle. It attaches to that medial malleolus that we can see here. And any sort of injuries come from excessive eversion of the foot. So remember, inversion and eversion is named according to the soles of the feet. So inversion means the soles of the feet rotate medially towards each other and they face each other, and eversion means the soles of the feet rotate externally, or I guess rotate laterally away from each other. So if there is severe eversion happening at this joint, that will cause damage to this deltoid ligament. The thing is, especially compared to those lateral ligaments, this deltoid ligament, we can see it's a little bit more hefty, and they're a little bit more, it looks like they're a little bit more together. They're a little bit more with it. They work together a little bit better, especially at their attachment point at that medial malleolus. So because of this, if there's any sort of injury to this deltoid ligament, it's usually not just the ligament that gets damaged. It usually leads to an avulsion fracture. So what that means is that the bone itself tends to fracture because this ligament is so strong that it pulls that away with it. So here is my visual to try to help you understand what it means to have an avulsion fracture and what it means for that medial deltoid ligament to get injured. So it happens a lot in sports, but we can see here in this slowdown that that is definitely broke. So let's move on and talk about muscles in the dorsal aspect of the foot. The dorsal area of the foot is relatively easy to learn in terms of musculature because we really only have one set of muscles, all right? We have our extensor digitorum brevis muscle, and based off of its origination point and insertion point, we can see that it's involved with toe extension. We can see the muscle bellies originating on the dorsum of the foot and those tendons extending downwards. So just be aware, some textbooks, some programs like to talk about the extensor hallucis brevis, which I have circled here. For all intents and purposes, it can be named as part of the extensor digitorum brevis group, but it is also okay just to single out the one that goes to the big toe and call that extensor hallucis brevis. Whether you're talking about this one muscle or both muscles together, they are both innervated, or they're both supplied by the dorsalis pedis artery, and they're innervated by the deep fibular nerve. Just as a reminder that dorsalis pedis artery is an extension of the anterior tibial artery. Now let's move on and talk about the plantar foot. To make it easy, we can divvy it up into 4 different layers. So the first layer has 3 muscles. The second layer has 2 muscles and 2 tendons, and the third layer has 3 muscles. Our fourth layer also has the 2 muscles and 2 tendons. So if it makes it easier to remember, the odd number layers have 3 muscles, whereas the even number layers consist of 2 muscles and 2 tendons. Like I said, grouping is the best way to learn anatomy, so this is the best way to group, and then we'll try to subgroup from there. So let's first talk about our first layer of the plantar foot. Like we said, it has 3 muscles. We can further distinguish these muscles by saying that it consists of 2 abductors and 1 flexor. So let's identify where these muscles are and what they look like in this first layer of the plantar foot. So the first muscle we're going to look at is our abductor. To be specific, our abductor digiti minimi, which runs laterally, pretty close to that little pinky toe, as we would expect with the name having digiti minimi in it. Our second muscle is our abductor hallucis muscle. So it's our second abductor running on the medial side of the foot towards that big toe, as we would expect with a name that has hallucis in it. Our third muscle is the flexor. So it's our flexor digitorum brevis, which runs dead center, and we can see it pretty easily. It usually has a pretty hefty muscle belly. Now let's move on and talk about the second layer of the foot. So in our second layer of the foot, we can actually see some arteries and nerves, and of course veins. It's essentially our neurovascular bundle. So they're best located between layers 1 and 2. So we've already talked about layer 1. We're about to jump into layer 2, but before we get into that musculature, let's first look at all of these neurovascular stuff. So first we can see our lateral plantar nerve and our medial plantar nerve. Running with this are the corresponding arteries with the same name. So now that we've identified that, let's take a look at what else we should find in the second layer. So as a reminder, we're in an even layer, second, so we're expecting to find 2 tendons and 2 muscles. So the first tendon we're going to look at is the tendon of a muscle that we've previously seen. It's the tendon of our flexor hallucis longus. Remember, that was our Harry of our Tom, Dick, and Harry trio. The second tendon that we'll find is our tendon of our flexor digitorum longus. And again, that's the Dick of our Tom, Dick, and Harry. And we can see this tendon of the FDL runs towards those tippy toes, as we had said. The next muscle that we'll look at, so again, it's 2 muscles. So 2 muscles, 2 tendons. A way to remember these 2 tendons in the second layer is that here you have Harry, Dick. All right, so those are our tendons. For our muscle, they're both attached to Dick. So we have our quadratus plantae muscle, which is on more of like that posterior side that attaches at an angle to the tendon of our FDL. And then we have our lumbricals, and those attach, much like with fingers, those attach in between the tendons of the FDL. All right, we're halfway through the foot now. We're going to talk about our third layer. Remember, that has 3 muscles, 2 flexors, and 1 adductor. All right, so in this third layer, before we start talking about muscles, we're going to talk a little bit more about neurovasculature again. So our deep arteries, they're located between layers 2 and 3. So just to reorient you, we have our lateral and medial plantar nerves, along with the corresponding arteries, the lateral plantar and medial plantar arteries. If we follow this lateral plantar artery more anteriorly, we will see it dive down and turn into the deep plantar arch. Just as a reminder, this artery, this deep plantar arch, it anastomoses with the dorsalis pedis artery that we found anteriorly coming off the tibialis anterior. So that's a key relationship, so don't forget that. In terms of muscles, one of the first muscles that we'll see here is our flexor digiti minimi brevis. So it's a little bit more medial compared to our abductor digiti minimi that we saw in the first layer. Our next muscle is our flexor hallucis brevis, which we can see highlighted here. And again, it's just slightly medial, or I guess here it'd be slightly lateral compared to this abductor hallucis that we saw in the first layer. And then next we have our adductor hallucis, our adductor hallucis, and it has two heads. All right, it has the oblique head, which was highlighted first, and then the lateral head, which was highlighted second. So this layer of muscles, I just remember it's the 7-11 muscles because the muscles make that pattern. So it makes that 7, and then the two flexors make that 11. All right, now we're at that very last layer of the foot where we have two muscles and two tendons. All right, if you haven't figured it out by now, the lower limb is just the upper limb turned over. So when we get to that fourth layer of the foot, it's not that much different than the deep layer of the hand. So if we look at the foot from a dorsal view, we can see our dorsal interossei. And looking at it from more of a plantar view, we can see our plantar interossei. So here we can see that we have 3 plantar interossei and 4 dorsal interossei. That is very similar to what we see in the hand as well. And the mnemonic for the foot is the same one that I have for the hand when it comes to the interossei. 3 on the P, 4 on the door. So that means you have 3 palmar interossei, so 3 on the P stands for palmar, and then 4 dorsal interossei, so 4 on the door for dorsal. Muscles of the fourth layer, and remember our fourth layer will have 2 muscles and 2 tendons. So let's talk about those 2 tendons. All right, so looking at the plantar surface of the foot, we can see our tendon of the tibialis posterior coming in. So as a reminder, that's our Tom of Tom, Dick, and Harry. And then if we look also at the same view, we can see that it crosses with the tendon of the FL. So that stands for fibularis longus. So the tendons in this layer, we remember it as Tom's big fib. So Tom from tibialis posterior, and big fib just stands for fibularis longus. So just think big we're just using that interchangeably with longus. All right, and I just wanted to leave you with one last mnemonic. So we're going to talk about muscles in the foot that are innervated by the medial plantar nerve. So most of the muscles are innervated by lateral plantar nerve, but there are just 4 muscles that are innervated by medial plantar nerve. So if you memorize these 4, then you know by default everything else is innervated by lateral plantar. So the mnemonic for this is LAFF, okay, L-A-F-F. So what that stands for is our first lumbrical, our abductor hallucis, our flexor hallucis brevis, and our flexor digitorum brevis, okay? So just as a way of remembering it, most of these you can see is located more or less more medially compared to the other muscles. All right, so these 4 muscles are the only ones that are innervated by the medial plantar nerve. All the other plantar foot muscles are innervated by the lateral plantar nerve, so don't forget that. All right, so I'm all done, but of course, I must leave you with a bad dad joke. So here's this video's joke. Why doesn't England have a kidney bank? Well, they don't have one because they have a Liverpool. All right, now I really am done. I hope you enjoyed this video, and I'll see you in the next one.